it's Dr. Schroeder with this week's video introduction to week number 7 of our course in the Principles of Healthcare Research. This weekend I'm in my home office, so the last couple weeks I think you've seen me probably in a white lab coat and in a clinical office while I was doing some clinical work. So this week I'm actually at home, so it's kind of nice. I have my regular computer here and my regular environs to go ahead and make the video, but we had a very good discussion this week. Of course, this week we were introduced to the study, the Lin, Lee, and Hicks study, I believe it is. This is the end-stage renal disease patients in Taiwan and their attitudes towards hemodialysis and the choice to go on hemodialysis. And the primary discussion this week focused on the target population, or excuse me, the sample size, and was the population that this study was meant to capture the attitudes and beliefs and the feelings of. Was it clearly stated, was it clear enough that it could be used for further research? And overall, this is a fairly typical of a qualitative study. It's a rather small scale study. Small scale in the sense that it's very focused on the needs of a relatively small population. This study was conducted in Taiwan. The study described that it's southern Taiwan, and that they had recruited subjects from a variety of, or from a smattering of dialysis centers. And they chose 6 males and 6 females. That was the one thing that they wanted to do, was to try to keep it as homogeneous as possible. They tried to make it even numbers of males and females. One thing that was picked up, though, is that, and many of you had noticed, that it was stated that the average age of these patients is actually younger than your typical dialysis patient in Taiwan. And so some of you questioned, does that make this questionable? That means that this is a good study, or does it mean that perhaps that the researchers should have gone and tried to get more subjects that would more clearly match a target population? And a couple things to point out is that in this particular study, kind of reading between the lines, I'm sure that the subjects are probably having some difficulty recruiting subjects for this patient, or for this study. It's not always easy, especially in a qualitative study, when you're going to be talking with people for an hour and a half about their experiences about something. It can be difficult, and that may be one of the reasons why. I'm kind of inferring it here, and it may or may not be. I don't want to read into the study which was undocumented, but it may be just the length of time that it was going to be required for these people to be in this study, that there may be some possible reason why the older patients chose not to step forward. It's important to realize is that you have to wait for people to step forward. If somebody doesn't step forward and actively say, I'm going to participate, there's really not much you can do. You can present to them, you can try to recruit people, but you can't go in and beg, you can't go in and promise them some special gift or something. You really can't pay respondents for this type of a study. They have to do it of their own volition, and I think that's why we saw that the study had relatively few older people in it, and it was a primarily younger population. Transferability is a similar concept to generalizability in a quantitative study, although in a qualitative study, when we're talking about transferability, this study results does not necessarily have to apply only to end-stage renal disease hemodialysis patients in southern Taiwan. It can actually apply to really any group that substantially matches the culture and the demographics and the general the general makeup of whoever the population is. So, for example, maybe other Asian populations, it may be useful, or that the results may transfer to that. Possibly Taiwanese or Chinese Americans, if you can just demonstrate or show that they have a similar makeup. Again, the reason for qualitative research is not to try to prove anything statistically or to try to make statistical correlations, so it's a little bit of a looser interpretation. If you read this and if it sounds like it may have some bearing, because you really can't use the results to prove anything, all that you can do is say that it gives us a little bit of insights about what the attitudes for a particular population may be in a given situation. then it's really okay to do that. It's really pretty much left up to you, the reader, to determine are these results transferable. And people are given, as a consumer of research, you're given great latitude to do that, especially in qualitative studies. The discussion for this week, we touched on it a little bit this week about what the results mean and how good were the results. That was sort of inherent in our discussion. But this week we're going to be talking about looking at the same study, and we're going to talk about the actual data analysis. We didn't talk about data analysis too much this week in week 6. So in week 7, we're going to shift our focus to the data analysis. How did these researchers grab that data? How did they determine it? How did they distill it? How did they come up with their findings? And overall, was it a good study? Was it a credible study? Did they follow all the rules, and did they do what they need to do in order to make it a valid study? And that's going to be the focus of our topic this week. Also, in end of week 7 on Sunday, not Saturday like I said with the last one, but on Sunday, your qualitative critique will be due. Very much the same format, and all of you have received feedback and gotten your grades on your quantitative critique, which of course is very similar. And so you pretty much know the drill, that there is an article for you to review, there's a template to fill out, and just go ahead and use that template, go ahead and fill it out. You can use the feedback that I gave you as far as for any formatting issues, or for the level and scope and depth of the critique that I'm looking for. I gave some of you, well, I gave most of you gave everybody feedback. Those of you that, the feedback needed to be a little bit more robust in those particular criteria that were identified, I kind of sort of asked some questions that would, help to sort of increase scores in those particular areas. But if you have any questions, go ahead and let me know. But this scoring method and the actual critique itself is going to be very similar to what you did with the quantitative critique, just looking at qualitative aspects of a study. And then in week 8 is going to be your final exam. I have to double check the dates, but I believe your final exam is going to be open from late Sunday night of week 7 through to Friday of week 8. And it may be Thursday. I will double check that and I'll post the dates. We're supposed to have our grades all completed by Friday, but sometimes on these online grades, they want us to keep it open a little bit longer. So I need to check and see exactly what those dates are going to be. But that's going to be in week 8. So remember, you have the final exam, very similar to, and again, kind of sort of the same look and feel as the multiple choice exam you had at the midterm. So be preparing for that, and let me know if you have any questions. And once again, everybody have a great week. I look forward to participating once again with you in our discussions and giving you feedback. And we'll see you in the discussion forums.